Well, hello everyone, and welcome to Lighthouse Outlook, the podcast dedicated to guiding you through the complex landscape of investing. I'm your host, David McNichol, president and founder of McNichol and Associates Asset Management. Here at Lighthouse Outlook, we delve into the essential strategies and insights necessary to make safe, informed investment decisions. Our goal is to equip you with the knowledge to confidently navigate the financial markets. Each episode will cover crucial topics from market dynamics to innovative investment strategies, all designed to help you to secure your financial future. Lighthouse Outlook is available on all major podcasting platforms, including Apple, Spotify, and YouTube. For those looking to enhance their experience, I encourage you to register on our website for free. By registering, you gain access to exclusive content and the opportunity to participate in live podcast events where you can engage directly with our expert guests. So subscribe today, become part of our community, and take the helm of your investment journey. Let's dive into today's episode. I'd like to introduce Dr. Tran, who I've met several years ago, and Vu is a working doctor. He'll introduce himself shortly, and also takes the time to try to educate other medical professionals on how to find their way through the very complicated space of the investment world, and it's very complicated, especially for busy people. So Vu, thank you very much for joining us today. This is I think will be interesting. We'll see how it goes, and we'll share some ideas. So Vu, thanks for putting up with that opening monologue there. We've had several of these discussions before on your podcast, and many other discussions. And once again, welcome. Maybe you could just introduce yourself to the audience, and we'll take it from there.
Yeah, well, first of all, Dave, thank you very much for inviting me on your show. I'm actually extremely honored, to be honest. How often does a physician get invited to a financial talk show? So I'm extremely honored to be on your show. So a little bit about myself. I'm a physician. I came from Montreal. So I studied my entire life in French on the Francophone system in Montreal. I studied as a family doctor and then studied as an emerge doc and came to Toronto in 2000. And since that time, I've gathered a few, designations behind my name. One of them, which is the more important one, is an MBA in about 2008. But I've made a lot of financial mistakes in my life, despite my MBA, because to be honest, an MBA doesn't teach you about personal finance. It teaches you about business and corporate stuff, but it doesn't teach you about personal finance. So in making all those mistakes, I've went through the University of Hard Knocks and learned personal finance on my own. And currently, I do a podcast where I share my learning, my own experience, and other people's experiences, and my guests' wisdom with the entire Canadian healthcare community.
That's excellent, Vu. And I remember when we first met. So you came to Canada, and you decided to take your degree in Quebec. And so you had to fully learn the French language, or did you have some background in that from back home? Or
No, not at all. I came as a boat person, as a boat people in 79. I remember we landed in airport Mirabel, which is Mirabel back then. I don't even know if Mirabel still exists anymore. And it was in the middle of winter, December. And I remember being like, this is not like Vietnam. Why is it so cold here? And I was 4 years old at the time. And so I did my entire studies in French. I went to JK, SK, in kindergarten and all that, all in French. So French essentially is my first official learned language. Cantonese is my second and English is my third. So I did all my studies in French up all the way to university and postgraduate.
Are you good at mathematics? Just a question in the left field here.
Well, I guess the answer is yes, uh, because that's what you needed to get into med school. But since I've been in med school and especially in emergency medicine, I gave all the math back to my teachers. It's funny you asked that because my children are now in grade 6 and grade 10, and they come home with math questions. I'm saying, I don't know, ask your mom, because
Yeah.
I haven't done math. I haven't done math for so long that I don't even know what 1 plus 1 is anymore.
The reason I ask that is in order to understand languages, like if you excel in mathematics, I understand that they sort of go hand in hand. So, but you were a 4-year-old boy coming to the country off a boat, literally, and literally had to learn two new languages, basically French first and then English. So, congratulations, that worked. And then, so you went through normal schooling and then high school, and then where did you go to university? And then how did you decide you wanted to become a doctor?
Well, the second question, why or how I decided to become a doctor, is actually quite easy. You know, I was raised in a very typical Chinese family, especially Chinese immigrant family. So, you could be everything you want as long as you're a doctor, a dentist, or a pharmacist. And so I was sort of brainwashed into those type of professions. And my dad was a traditional Chinese physician who practices, herbal medication and Tai Chi and Qigong and all that. So my entire life, I was sort of quote unquote brainwashed into getting into some sort of healing profession. And medicine was just a natural thing for him to guide me towards. I jokingly say brainwash, but to be honest, if I wasn't a doctor, I wouldn't know what I would be. Jokingly, I say I'd probably become a chef because I like eating and I like cooking. But so that decision was sort of made easily for me. Growing up, I used to watch, Guy Lafleur, Guy Carbonneau, Bob Gainey. So I wanted to be a hockey player, but unfortunately didn't know how to skate, not big enough, not tall enough, not strong enough. So I quickly abandoned the idea that I'd be a hockey player. So I chose medicine. In
And sorry,
terms
where did
of,
you go to medical school?
yeah, so in terms of med school, I went to Sherbrooke. So Sherbrooke University is one little small town in the Canton de l'Est, or the Eastern Townships in Quebec, which is about an hour and a half to 2 hours east of Montreal. And the famous university there is actually Bishop University. But I didn't go to Bishop. I went to Sherbrooke, which was the French school at that time and the only medical school in the Eastern Townships of Quebec. And after med school there, I came back to Montreal and went to Université de Montréal. And from there, came to Toronto. And after that, I did all my schooling in English after that.
I see. And just finishing it off on your education, where did you do your MBA and what did that teach you?
My MBA, I did it with Richard Ivey School of Business, which is the University of Western Ontario, but they have a campus here in Toronto at the Toronto Stock Exchange. So I did the executive MBA in 2006 and finished in 2008. And what I learned in my MBA, to be honest, I'll tell you, it was a life lesson. And that lesson was, as a physician, I knew nothing about anything else. I was very good at being a physician. I was very good at treating patients, and I was very, very good at medicine and science, but I knew nothing of the world. And the MBA opened my eyes to the rest of the world. And in class, I felt like the dumbest person in the entire world because I was, sitting next to other people who are in finance and in engineering and law and all these people who knew something about business and the world, and I just knew about medicine. And it was an eye opener for me, and it was to this day I find it was the my greatest um, university degree ever. Obviously, I wouldn't be a doctor without my MD, but I really, really enjoyed my MBA much more than I enjoyed my MD.
Okay, this is interesting. I'm learning something today, and this is very good. It sounds like to me you're a very competitive person, and you're thrown into this environment to take an MBA when you already have a medical degree, and all of a sudden you want to catch up to everybody else in the room. So that's good. That's very encouraging. I'm an engineer by training. I didn't even have the wherewithal to think about medical school. I'm very fortunate to have three kids who have gone through the Richard Ivey School of Business, undergraduate HBAs. So all three of our kids made it through there. It's the greatest program, and I'll never forget when I walked through with our eldest and getting a tour from one of the proctors, and I was so verklempt, going, why didn't I do this? Like I did engineering, that was fine, but I think business would have been more sort of up my speed. And anyways, life has these channels, these choices that we all make, and but anyways, all three of ours made it. Three of our kids made it through, and our eldest, I think I told you this already, decided to go back and get a medical degree, and so we've got a doctor in the family like you. So sort of a doctor who's got a business background, and you're a doctor who's now got a business background, and I think that's so important, like just to understand both sides of the brain and or how to like operate and function in this world that we live in. It's a crazy world. So that's great. So we're up to speed on your background and so forth. Maybe tell us a little bit about your podcast as a preamble, so that hopefully some people jump on that. And it's mostly meant for doctors and medical professionals. Tell us about that a bit.
The podcast is called How Is My Financial Health Doc? And it's really spelled that way, How Is My Financial Health Doc? And it's on all the platforms, the major platforms that you would know about, Spotify, Apple Podcast, iHeartRadio, Stitcher even. And the name of the podcast is How Is My Financial Health Doc? Because it's one of those questions. I wanted to make it very similar to what a patient would ask me, how's my health doc when they come and see me in my office? And so I put it this way because a lot of my colleagues will say, hey, I don't know what to do with XYZ in finance. So it's like one of those, you're sitting in front of me and you say, how is my financial health? How can I mend this, or what do I need to do to get this right? And even though it's for physicians, it's really not. It's for everybody in healthcare. And a little bit beyond. The reason I say this because we're all trained in the same mold. Whether we're a physician, a nurse practitioner, a physiotherapist, an optometrist, a chiropractor, name it. Anybody in healthcare, we're all trained in the very same mold, which is, looking at the lens of biology and science. And we've never had to look at it from a lens of business or a lens of finance. And so I would venture to say, and I don't think I'm wrong, I would venture to say that the vast majority of us are not financially fluent. And so the podcast itself is about, giving back to the community a little bit of financial fluency, the basics of personal finance, the basics of finance. And we're not talking about corporate finance here. We're talking about personal finance. Basic concepts as what is cash flow, what is compounded interest, what does it mean to save, what does it mean to invest, should I even save, should I even invest, what's the difference between the two? So we go from those very basic concepts to very, very sophisticated concepts such as pension plans, whole life insurance, immediate funding arrangements, crypto. We go as far as as ETFs and derivatives and stuff like that. But the entire goal of the podcast is to give people a sense of their own personal finance, and I always tie it back to what it means to the individual, the impact to the individual. It's not about making money. And that's what my podcast never says. I'm not doing this so that you can buy your next Ferrari, or I'm not buying this so that you can buy a bigger home in, the bridle path. The entire idea about the properly managing finance is to be able to buy back time, which is really, in my mind, the only true asset. There's only two true assets, really, time and health. And so how do you use personal finance to get those true assets, which we all want, health and time? And why is that important? in across the globe, across Canada, across North America, physician and healthcare provider burnout is a thing. If you look at the statistics, 40 to 50% of all healthcare providers across the globe are burnout. When you look at family physicians, it's closer to 60, 70%. When you look at emergency physicians, which I am one of them, it's 86%. So you imagine that. You walk into any emergency department in Canada, any, choose one. 9 out of the 10 emergency physicians are burnt out. So if they're burnt out, how good of a care do you think you'll receive as a patient? And if you think about the burnout rate and how it is closely tied to personal wellness, and I don't call this personal wealth, I don't call this, richness, I don't call this anything, I call this financial wellness, because financial wellness doesn't mean being rich. Financial wellness means being able to purchase back time. And so if you're not financially well, you cannot be mentally well, you cannot be spiritually well, you cannot be ethically well, you cannot be professionally well. And if you're not well, how do you take care of your patient? And I think it was Brene Brown who said, or someone who talks about burnout a lot, is if your tank is empty, how do you give? You can't. And so the first thing to do is replenish your tank so that you can now give. And that's the entire idea of the podcast.
Now, the people you deal with in your profession, they're so busy, and you just mentioned they're burnt out to a certain degree. They've had more education than probably any other profession known to man. How do you actually get their attention so that they can listen and learn without trying to figure it out themselves?
That is a great question, a wonderful question that I don't have an answer for. I think I have part of the answer. Part of the answer is, one, building awareness. You don't know what you don't know. And if you don't know you're unwell, you will never take steps to get well. And it's very much like, people who have issues and disorders with alcohol. Unless they realize that they themselves have an alcohol problem, they will not take the steps to actually correct it. And personal finance for the healthcare community is very similar. We are very high achieving individuals, I would say. And as you mentioned earlier, we're very well educated. But I'll be the first one on your podcast to say this, and I'm not afraid of saying this. We are probably the dumbest smart people you'll ever know. So we are very smart in what we do, but we are very dumb in everything else. As I explained to you earlier and shared with you my experience with my MBA, it's not like I haven't done a lot of, university. I've done postgrad, I've done residency, I've done emergency medicine, etc. I thought I knew medicine, and I probably did, but I knew nothing of the world. And in my experience, we know nothing of finance. And so you'll probably come across this, and you most likely have, Dave, in your practice, that physicians are not very intelligent with their money. We're not very intelligent with almost everything else in life. There are always exceptions. There's always the outliers, but the vast majority of us are very good at what we do, and that's about it. And so the idea of the podcast is to try to increase that bandwidth a little bit slowly, taking that elastic and stretching it slowly so that over time people, get osmosis knowledge that way. And what is important to me in my podcast is, not talk about crypto. That's not the goal of the podcast. The goal of the podcast is talk about financial fluency, financial planning, having a strategy, which is what you and your team do for your clients, is building that strategy, building that end game, understanding the end game, and then over time building enough fluency so that when wherever into the market to purchase whatever products or solution there it is, that we have enough knowledge to ask the intelligent questions. And right now we're not asking the intelligent questions. Right now we're just purchasing the product, Like I would go and purchase a head of lettuce. But, when I'm going to make a meal, I don't just go ahead and buy a head of lettuce. I go and I know what I'm going to plan tonight, what I'm going to cook tonight, and I'm going to plan out what I'm going to go buy. I just don't go buy a head of lettuce willy-nilly. And that's what we're currently doing. So what I'm trying to get to the community is, if you're going to make a meal tonight, you better know what ingredients you're going to buy, and you better know how you're going to put the ingredients together and how you're going to cook it and at what temperature. And that's what we're lacking currently.
Yeah, no, you're making my mind spin with I'm a little older than you. I've been at this since the 1980s in the investment world, and I've met all sorts of different investors, and I've met all sorts of doctors and dentists and medical professionals, and yeah, I would never say like they're not dumb like you might have alluded to earlier. They're just busy people. Frankly, they've been taken advantage of in the past in many cases. So they're looking at me as maybe potentially another person that might want to do that. And that's for the people that know me and our clients and our medical clients, like we just don't operate that way. We're into like fully opening the kimono and they see exactly what we are and then they make the decisions. And so it's interesting. Doctors are very smart, but they're also, I go back to that same comment, they've been taken advantage of. So they like once bitten, twice shy. They want to make sure that they are making the right decisions and or they start to do them on their own. And for some of them that might work out, but for many of them that can actually be the kiss of death because they just don't have the time to make those decisions on their own. So yeah, it's a very different client set. I could compare them to lawyers, very different. Doctors and dentists, I would maybe put into the same sort of camp. But the fact of the matter is, we're all busy, especially nowadays. I go back to, COVID is our new starting point for everybody in this world. And we've all become a lot more focused and just we know what we want now ever since things have changed. So going back to investments, doctors can do it on their own. Especially, we've been in this incredibly long rising market since 2009, and they can try to attempt to do it on their own. But the smarter ones over time just find some group. I don't mean just ours, but other groups that they can trust and learn from. So it's all about education. And the financial world, it's interesting. It's like a slow drip of information. You can go do your securities course. You can go do your CFA and your Canadian investment management designation. Those are all fine, but ultimately, they're not going to really teach you how to invest your money. Like you have to make those decisions yourself. So, anyways, that all said, we're both after the same approach is to help these professionals. So let's shift gears here a little bit and go into, and you've talked to me about this in the past, like what has worked for your audience, what has worked for the doctors and the medical professions, and what has not worked. Like what are some of the worst mistakes they've made in the past?
I'll share with you a couple of my mistakes because I know what bad mistakes I've made. And I can share with you some of the mistakes my colleagues have made. And to be honest, there's probably millions of mistakes out there, some of them small, some of them big. So I'll share with you mine. My first mistake, which is why I created the podcast and which is why I started to learn about finance myself, was I didn't pay attention at all. And I think that is a good 80% of us. We don't pay attention. We don't think that finance is important. And if you spoke to me in 2013, I was that person. In the last 10, 11 years, I've become someone else. But if you spoke to Dr. Tran in 2013, this is what you'd see. You'd see a doctor who's very much engaged in medical practice and science, who's very engaged in learning about the newest and brightest thing in medicine and how, this medication and that intervention will save your patient, and continue working. I don't know if you believe me, I used to work 8 days a week. And that's what I was focused on. The Dr. Tran now is very different. I'm still engaged in my practice. I still want to know what's new and what's the latest, but I no longer neglect my personal finance. So that's the difference. And so the one thing that I would say, the most common mistake I see is we neglect our personal finance. And we do it by several ways. And we're all in mechanism of defense, which is denial. Is, well, I'm good, I'm fine, which they're not, but they keep saying they're fine. Or my accountant takes care of it, which is not true because their accountants take care of tax filing. They don't take care of their finances. Or they'll say, well, my husband or my wife takes care of it, which is partly true and partly not. I have a colleague who her husband works in quote unquote finance, but it's in corporate finance and has nothing to do with personal finance and investing and risk mitigation and all that. But they equate the same thing. And so the one thing, the most common mistake is we neglect it and we use denial. And that was me in 2013. The second mistake, most common mistake, is not understanding what the product is or what the solution is. So I'll give you an example. Many of us, like the population, don't understand the difference between an RSP and a TFSA. Most of us don't understand what a pension is and what's the difference between a pension and an RSP and a TFSA. We don't understand what term insurance does and doesn't do. We don't understand what whole life insurance does and doesn't do. We think it's insurance, and someone on the radio, on TV, on CNN, on some Facebook group says, you should do this and not that, and they'll take it at face value because that's what I've been told by, the social media on TV, without truly understand the personal impact and the long-term impact. Mistake number 2 is we don't understand what it means and we don't take the time to learn about it. And mistake number 3 is not understanding the math. You said earlier, to become a doctor and to understand language, I must be good in math. I was at some point, and I gave it all back to my teachers. Literally, I gave it all back. Prior to 2013, being a bright doctor that I was, I knew nothing about math and didn't understand how the realm of personal finance worked. Didn't understand compounding, didn't understand time value of money, didn't understand time horizon, didn't understand any of those type of things that have to do with math. And so we make decisions that are very short term. We make decisions that are glitzy, like it's a nice shiny penny over there, so I'll go over there, without understanding the impact, nor without understanding opportunity cost. And so not understanding the math of our decisions is another mistake. And finally, another mistake that many people have shared with me, which you have alluded to already, is we are often victims of the financial industry because of our vulnerability, because of all the different reasons I've mentioned, because of our vulnerability. A lot of people in the financial industry will take advantage of us. And as you've mentioned earlier, once burned, twice shy. But we don't seem to learn that lesson very well. So we fall into various traps a lot. And a lot of these traps are insurance based. A lot of these traps are, what I call dumb doctor deals. People come to us with deals and we say, oh, it looks great. It looks fine. Oh, my buddy did it. So you know what? I trust my buddy. So therefore I'll do it, without realizing, understanding again the math behind it, without understanding the long-term impact, without understanding opportunity cost. And some of these deals are in fact scams. And I've had a few colleagues who've lost hundreds of thousands of dollars because they were involved in these scams. And so you imagine you work 8 days a week like I used to, possibly having a divorce or two, and now being scammed out of hundreds of thousands of dollars. And on top of that, you're trying to climb out of a hole. So if I were to ask you which profession in Canada starts you off at minus $300,000, you'd probably be able to name two: physicians and dentists. Right? So it costs a lot of money in North America to complete a medical degree. The average loan or debt of a physician at time of graduation and on first day of practice is somewhere roughly between minus 250 to minus 300 grand. So you start off your career and you start off your life at minus 300, where everybody starts off at maybe minus 220, minus 30 at the worst.
Yeah.
Physicians and dentists starts at minus 300. And on top of that, you've just scammed out of 100 grand or 200 grand and you're trying to make up for it. And so it's a really, really bad situation financially for most physicians because they've neglected, they don't want to understand, or they try not to understand, or they're too busy, right? Like you say, we're busy people. Well, you know what? We're not the only busy people in life. Lawyers are busy, accountants are busy, engineers are busy. Name me one person who's not busy. There isn't. Everybody's busy.
Yeah.
But if it's a priority, then you actually make the time for it. And unfortunately, we don't make the time for it.
No, it's so true. And I gotta throw another word in there, pride. Human pride is just incredible emotion. And sometimes our pride gets in the way too, because maybe intellectual, there could be a bunch of reasons, but our pride sort of holds us back from asking those extra three or four important questions, or referring to someone else, like throwing our pride aside and asking someone else, I don't know what I'm looking at here. Can you look at this for me? And it might be, another doctor friend, or it could be someone not even in the medical profession. But and pride's an incredible thing. Yeah. Anyways, I just wanted to follow up with that one statement because if people would just ask a few more questions, not of the advisor, because the advisor is probably in many cases telling them what they want to hear, and they just want to, both parties want to move on. Asking outside of your comfort level these questions, but unfortunately people don't. We're all busy. I call it pretend busy, honestly. I think we're all pretend busy in many ways. Like, we think we're busy, but the only thing we all have in common, every human being on this planet, is we all have the exact same amount of time to do something. And for the most part, we all have the exact same amount of time to fulfill something, plus or minus a few years. And if we just actually make better choices and ask more questions and be more curious. Curious is another really important word, but we're not. We're too worried that someone's going to think, oh, that's a dumb question. I get this all the time. Well, I didn't want to ask you that because I thought you'd consider it a dumb question. Well, actually, some of the questions that people think are dumb are some of the best questions I've ever been asked in my career for what I do. So don't ever hold back from dumb questions. Anyways, I just had to go into a little sidebar there from what you're doing and talking about. So this is interesting. Maybe just I need to do a plug for doctors and how the tax rules are changing all the time, but how they can maybe try to put some more money aside. I believe strongly in a pension plan approach other than just retirement assets, retirement RRSPs. Maybe just put in a little bit of plug. Have you spoken to your circle about how they can do things over and above registered assets?
So I'm gonna talk a little bit about pensions to answer your question, but I will be very transparent, and I'm going to disclose I am the co-founder and the president of the Canadian Physicians Pension Plan. So I want everybody who's listening beyond this point realize and understand that, I am the president and the co-founder, and I'm obviously conflicted. But I will answer your question in this way, very general way. I've learned over time that our RSPs in itself are not the best and optimal solution for high income earners. In fact, it's not even a good solution for low income earners. It's a somewhat good solution for middle income earners. So when I'm speaking to colleagues who are either engineers, lawyers, dentists, accountants, nurse practitioners, small business owners who, own a company and hires, 35, 50 people as employees, we're talking about potentially people who are high income earners. And the RSP as a registered plan is just not adequate. And in fact, in the long run, it's punitive. And so when you look at pension plans, they're more suited for that type of professional. And I was just talking to and today exactly is the end of the school year. Both of my children, one is in grade 6 and one of them is grade 10. So they're finishing school, and both of their principals are retiring.
Sure.
And my grade 6 daughter, her principal has worked for 25 years, and my grade 10 son's principal has worked for 27. And so they're in their mid to late 50s. And they're both retiring. And I'm like, oh my God, they're only 50s and they're retiring. And for me, it's like almost unimaginable. I'm 50 and imagining myself retiring in 5 years, it's not possible for me. And I asked myself the question, what's the difference between me and them? Well, the difference is they have a pension plan. The teachers have an amazing pension plan, which gives them financial wellness, social security. They don't have to think about it. It is an amazing plan that takes care of them. And as professionals, we don't have that. Dave, I know you're very financially savvy and you do this for people, but how many professionals that you have encountered that have their own pension plan? I would suspect that the answer is almost no one. And so when I realized that, hey, pension plans are actually the way to go for high income professionals, I decided to look for one. And I've spent my entire professional career looking for one, and I couldn't find one. Could not find one. So I had to build it. And so I built it for professionals. And when I say professionals, I'm including physicians, dentists, accountants, lawyers, engineers, mom and pop who operate under a corporation and owns a small business, a mechanic store, a restaurant, a retail store, Tim Hortons, a KFC. All those people who never had the benefit of what the teachers have, who never have the benefit of what the nurses have, or the paramedics or the police. This is the time. I've created something for all of us. And I would dare to say self-employed and incorporated individuals. Because having that safety blanket, and which is what I call the pension plan, it's a safety blanket. I remember, Charlie Brown, and I think the guy who has that blanket, what's his name? Is it Linus?
Linus, yes.
Linus with his safety blanket. I want that safety blanket. I want that financial safety blanket. And it's important to have one, because having that financial safety blanket will allow individuals to work properly, to not overdo it, and to have a balanced lifestyle. Otherwise, we're all burning out, and I don't think society wants a segment of the population, which is the healthcare providers, all burnt out, because it's not good for society. And so to be able to fight that, you need to fight that with a real antidote. I tell people you can do meditation, you can do yoga, you can do mindfulness as much as you want, but these are band-aid solutions. These don't change the course or the trajectory of disease. Burnout, I'll think of it as a disease. If I want to truly cure burnout, not treat, but cure burnout, we need to give people back their time. and financial wellness is one of the ways to do it. Doing more yoga will treat the symptom, but it will definitely not cure the burnout. And so it's very important to find a solution, a safety blanket that allows people to do that. And the pension plan does that.
No, I totally get it. And I think that's a great analogy going back to teachers who appear to be retiring at a relatively young age. But the fact of the matter is they've been, socking away a lot of money in their years. And so does the system. The system actually covers them as well. So they could be, in my opinion, they could be paid better, but they also do a very good job of putting money aside. And so that's like doctors can be paid very well. They have to find a way to put money aside, not just live like day to day within their means only. They have to actually be like putting money aside, especially in their early years, even when they have a young family, put some money aside. Too many don't do that. Too many just sort of live for the day. So, anyways, that's really good that you're doing that on the pension side. We also do that as well with personal pension plans, and I've found some incredible ways, not just me, but through a pension lawyer we work with, to put money aside, and even up to age 71, all the way from age 60 to 71. There's some really good ways for people, incorporated professionals, and people who work for themselves to put some money aside. And if you can't do it that way, then maybe you can do it through your company, through a pension plan that way. Well, let's wrap up here. We're getting to the end of our time. We've talked about a lot of different subjects. Is there anything that you want to put on the table? Anything you'd like to talk about before we sign off here?
I just, I want to thank you for having this show and this podcast to educate people, and your willingness to have a podcast to educate people in healthcare, because I think it's very important. And I say this a lot. We don't know what we don't know, and as physicians, we definitely do not have the same level of financial fluency as you do. In fact, because we spend 90% of our professional lives just trying to keep up with medical literature and trying to keep up with the best medication, the best intervention for our patients, that we do it for our patients. People who come into healthcare do it because they want to help people. That's why they went into healthcare. When you look at doctors, dentists, nurses especially, when you look at social workers, when you look at, all these healthcare professionals, the number one reason they went into this profession is because they want to help people. And they spend a lot of the time doing that. But the question I have is, who's looking after them? And that's the question that I have the most challenge with. Who's looking after them? Now, in the case of the nurses, they have a pension plan. So there's a systematic, you said it, system. There's a systematic way for them to save. For everybody else, there is no systematic way to do so. You look at a dentist, there's no systematic way. You look at physicians, there's no systematic way. You look at a chiropractor, an optometrist, there is no systematic way. And so my question has always been, all those people who are taking care of others, who's taking care of them? And I still struggle with that question. And I hope that everybody who listens to this podcast, whether you're an advisor, whether you're an accountant, whether you're a lawyer, whether you're a politician, whoever it is, you need to look after the people who looks after people. Otherwise, you're going to get a really, really group of people who no longer can take care of society. And so it's important to take care of people who takes care of people.
No, it's very true. It takes a village, obviously, to raise a child, but it takes a whole community to educate each other. And people, as I said earlier, just have to find a way to open up and communicate. And if they really want to learn and really want to understand about the financial markets, they have to ask more questions and put their pride aside. I keep throwing that out. So this has been quite enjoyable. Thank you for the time. And yeah, anybody who's listening in and has been kind enough to stay to the end, we're both here for more questions. So if you have anything you'd like to have answered, we'd be happy to send along Vu's email, and vice versa. Any professionals, any doctors, and that, we'd be happy to talk to you about what we do. This has not been an infomercial for that, hopefully. This has been more just a general discussion on helping people. So, Vu, thank you very much for the time. Appreciate it.
Thank you very much, Dave, for having me.
Okay. Well, hello, everyone, and welcome to Lighthouse Outlook, the podcast dedicated to guiding you through the complex landscape of investing. I'm your host, David McNichol, president and founder of McNichol and Associates Asset Management. Here at Lighthouse Outlook, we delve into the essential strategies and insights necessary to make safe, informed investment decisions. Our goal is to equip you with the knowledge to confidently navigate the financial markets. Each episode will cover crucial topics from market dynamics to innovative investment strategies, all designed to help you to secure your financial future. Lighthouse Outlook is available on all major podcasting platforms, including Apple,